I'm excited. So, thank you for joining me here tonight. Today is a cause that is dear to my heart, of course, being a chiropractor. I'm going to be talking about back pain. So I'm just going to assume that some of you who are on this webinar do suffer from back pain, so you'll be in the right place. What I'm going to do is try and make it as proactive as possible. So we're going to be doing a little poll. I'm going to ask 3 questions as we go through proceedings. Only takes a couple of seconds. Just give me your feedback, answer the question, so I can make it more relevant to you as I talk. We've had quite a few questions sent in. I'm going to be addressing those at the end, but please feel free to engage. Of course, this is a webinar, so there's a chat box. So please, any questions as we go through, pop your question in the chat so I can address it. Okay, well, let's go to it. So obviously my name is Dr. Tim Errington. I'm the owner of and founder of Total Health Chiropractic. Today we are talking about pain. And what I want to do today is as much good as I can. We all suffer pain at sometimes in our life. In fact, it's pretty much 100% guaranteed. But what I want us to do is from today, I want us to look at pain in a different way. I want us to have more respect for it. What is it doing? What is it telling us? Of course, we don't want pain, but it is an integral part of life. Most of us will have some pain almost every day of our lives, hopefully not too severe. But what we want to do is make sure that we don't ignore what I call the higher intelligence. The higher intelligence is that amazing intelligence that lives inside us. And when we get pain, of course, it's the body telling us that something needs to change. So back pain is the most common reason that under 50s seek medical attention. Okay, so what I'm going to ask Jerry to pop on the first poll, because what I'd like to do is find out from you, how often do you suffer from back pain? There's going to be 4 questions going to go up there. There they are. Do you suffer from pain all the time, frequently, perhaps 1 or 2 times a week, or maybe occasionally, or never? So just go ahead and pop your answers in there, because I'm really interested. We all get pain. So let's just see how this one pans out. Okay, well, I find this quite interesting. So what we've got here is the 7% of the people who are on have pain pretty much all the time. Now, what I'm seeing in front of me is this is a fair representation of what I see every day in my clinic. There are some people who have chronic pain. They have pain all the time. And obviously, this is what we really want to avoid. 1 person in 5 has pain frequently, so every week, once or twice a week. And most people have occasional pain, so from time to time, their body gives them a signal that something's wrong. And then a small amount of people, perhaps 1 in 20, never has pain at all. So lucky them. What it means is, because what we do know is that everybody will suffer from pain eventually. What I want to do today is make sure that I want you to think about yourself. If you're getting pain from time to time now, let's make sure that it doesn't become more frequent or constant. And those people that don't have pain, let's try and get ourselves in a situation whereby you never have to suffer from pain, because actually you don't. What you need to know is how the body works and apply some very simple strategies, and you can really look after yourself so you don't have to. Okay, let's just move that outside. Okay. So it is a fact that 1/3 of all adults suffer back pain in any year. That's a lot. During a lifetime, 80% of people will suffer from back pain during their lifetime. That's a big proportion of people. I think that people want to be looking at pain more as a vital sign. We know as doctors that when people have health problems, we check their heart rate, their respiration, blood pressure, etc. But the way the body is talking to us every single day is very often through pain. It is a vital sign. So we really want to learn how we're going to read our pain in the future. Obviously, people present in our clinics with different symptoms. Think about yourselves. What are the most common symptoms? Because what we're going to learn today is that once we understand the cause of the problem, then it guides us towards the cure. So let's think about your body. Think about how your body is telling you what are the symptoms you're getting. Classically, people start with a bit of an ache in the low back. The muscles tighten up. We start to stiffen as we lose range of motion. We start getting some leg pain, perhaps. Maybe there's some swelling, inflammation involved. Perhaps that burning which is associated with nerve pain, or maybe some numbness as nerves are being pinched. These are the type of symptoms that we want to be aware of. We don't want to just medicate them. We don't want to ignore them. We don't want to make like an ostrich, because our very, very clever body is telling us something. And we really want to be smart in how we deal with these things. I know that there is a huge pain industry in Singapore. It never fails to amaze me. Wherever I go, I see people taking painkillers and all sorts of medications. People choose TCM, acupuncture, massage, chop, 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 rub, 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 physiotherapy for soft tissue. People are putting ointments or massage. People are even trying sleeping on the floor, spending enormous amounts of money on changing their mattresses and the pillows. God, this is a really, really, really big industry. People try everything, and unfortunately, some people end up with surgery, which is the very, very last thing we want. I am dedicated to helping people stay away from surgery because it doesn't always go well. Somewhere between 25 to 30% of surgeries on disc problems have unfavorable outcomes. And there is something that is very, very real. It's a new health problem. It's a real thing. It's called failed back surgery syndrome. And in our clinics every week, we have people who come in that have had failed surgery. So we want to look at surgery as very, very much a last resort. All right. So when I look at the stats, what I found when I looked for some stats, I found an area between 1995 and 2005. So that's a period of 10 years. And these stats were quite incredible. There was a 65% increase in low back pain. There was an 188% increase in prescription medications, 423% increase in narcotic prescriptions. These are very, very, very strong drugs. A 682% increase in epidural applications, nearly 700% increase. There was a 300% increase in people going for MRIs, and then there was a 223% increase in spinal fusion surgery. Now, this was quite incredible to me when I saw these stats. Over that 10-year period, we can see where it's going. More and more and more people are obviously succumbing to pain. We'll find out why, but look what's happening as far as surgeries and medication. The medical profession are really getting to work, but are they addressing the cure? Are they addressing the cause? Because this really needs to be the thing. If we can address the cause early, we won't succumb to surgery. Okay. So the title of this course was the causes of back pain. So I'm trying to simplify things. So I'm breaking it down into 4 things. Obviously there's more. For example, if you have scoliosis, a twisted spine, obviously that's going to affect function, and then perhaps pain is going to be a result. But these are simple things that we can change in our life. And one of the things that we can change is our mind and how we think about these things. So the first one is macro trauma. I think you know what I mean. We all have some kind of macro trauma. God, I've had plenty. I've played rugby, I've crashed motorbikes, and I've fallen down mountains on my skis. I've had macro trauma and broken a few bones. In Singapore, we see car crashes, we see people falling downstairs and things like that. Macro trauma, these are things that have obvious, it's an obvious stressor on your system. Obviously, it's going to do some damage. Sometimes this damage can be serious. And obviously, if you have accidents like this, it's going to cause some pain. But what we want to make sure is that it doesn't cause sequelae. Sequelae are things that happen to us further down the line. Now, perhaps if you have a macro trauma, you've had a whiplash injury. That's something that needs to be addressed early. Otherwise, you end up with stiffness in the affected joints. Arthritis happens down the line, and then we lose function, and then we suffer pain. We don't want to go there. The second cause, macro trauma, by the way, it only accounts for 5% of the incidence of back pain. By far the greatest cause of pain is micro trauma. Micro trauma. This is 95% of the pain. Now, what is this? You've got a few pictures of some people. What are they doing? Well, they're probably at work. I'm talking about the cumulative stresses that build up in our bodies, mostly due to things that we do all day, every day. I'm talking about our habits in life. How do you spend most of your time? Is it with bad posture? Because bad posture is certainly going to cause cumulative stress that's going to build up in your body. It's going to stiffen us. It's going to give us cause premature aging. It's building up in our body. What we need to do is make sure we are aware. So why don't you just think about the things that you do often and spend time every day doing? Obviously, many of us are involved in texting, TV in the evenings, during the day, computers or driving. What about sleeping habits? You know, is that good or bad? What about posture? Are we getting enough movement? How is our lifestyle? Do we have a sedentary lifestyle? Because from what I see, most of us are now succumbing to this sedentary lifestyle, which is causing micro trauma. And this is actually the cause of most of our pain. It builds up. So we want to be aware of this. So yes, sitting is the new smoking. Think about how many hours a day do you actually spend sitting at your desk? I bet for most of you, it's way too much time. What about your family? You know, this is if you think about the modern life, I think it is actually tragically sedentary. We are designed to move. We're not moving. We are sitting there all day, every day. Maybe it averages 8 hours for most people. I don't know. Some people come in and tell me they're sitting at their desk for upwards of 12 hours a day. This is a direct cause of things like obesity and diabetes, heart disease, and statistically, it creates a shorter and sicker life for us. Okay? Much of this sedentary lifestyle is spent in front of a screen. And let's think of it. If sitting is the new smoking, then being in front of a screen is like the new crack cocaine. And I'm talking about addiction. We are literally addicted nowadays. You might think you're not. Well, try and stay away from your phone for an hour or so. It's pretty hard work. I know, because I too am clinically addicted to my screens. And it's something that I'm aware of and something that I work on. So we want to think about trying to make some changes here, for sure. What we're talking about here is the tip of the iceberg. Obviously, underneath the surface, there is a lot going on. The symptoms are what you feel. These are the body signals, how the body is communicating with me. What I'd like to ask now is that Jerry puts up the second poll. So I want us to find out, when does your body, yes, there we go. When does your body bother you the most? For everybody, it'll be different. First thing in the morning, at work perhaps, when you're at your screen, perhaps it's at night during sleep, or maybe it's when you're working out or participating in sports. But what about long walks or standing? Perhaps that's the cause. I'd like to know. Okay, I think that's very, very interesting. I'm looking at the stats. They're still changing a little bit, but by far the greatest time when people get bothered by their pain is at work. So again, that brings us back to this sedentary lifestyle. Quite a few people, it's when they're working out. So that's not good. Obviously, as chiropractors, we want you working out your entire lives. There we go. 20% of people suffer pain when they're working out, 20% when they're walking or standing for a long time. I understand that. For few people, it's during sleep. I'm actually going to address that later on. And also first thing in the morning. Some people feel the pain first thing in the morning, but by far the greatest proportion is at work. So that brings us back to this sitting, this sedentary life. Let's think in terms of our lifestyle, because if we can tweak our lifestyle a little bit after today, then I think that can have a huge effect, and I think a positive effect on your future life. So I think that would be a good thing. So under the surface, we know that the signals are on the top, the symptoms are on top, but underneath there is a lot going on. So let's think about what's going on, because I know that all these stresses of life are causing conditions of the spine. It's changing our postures. That's causing, in chiropractic, what we call something, and the name is subluxation. So if you come into our clinics, perhaps you've heard this word. After today, I want you to be aware of it. But basically, this is quite a long word. You don't have to remember it, but you have to know what it means. Most people that suffer back pain are suffering from misalignments of their joints. Postural changes means joints, weight-bearing joints, are out of alignment. That means there's going to be trouble down the line. Soft tissue damage is building up. Probably there's inflammation, nerve irritation results, muscle spasm, pain, and lost imbibition. What does that mean? Well, lost movement, stiffness, means there's less blood and oxygen and nutrition getting into those important discs, those vital discs that allow us to move freely, and joint fixation. These are all the things that people come into our clinic with. The term is subluxation, and this comes with this lifestyle. And it might be macro trauma, it might be micro trauma, wherever it's coming from, okay? We can call it movement deficiency syndrome. While we're on this term subluxation, let's just understand about pain and how it affects our lives. But there's more going on than that. There's a lot going on under the surface. If you have pain, it's coming from those nerves you feel on the left. You see them on the left. But as doctors, of course, we're more worried about those nerves that you see on the right. That's the autonomic nervous system, if you like. What you need to know is that your body is controlled by your nervous system. And if we think about an individual nerve, less than 10% of your nerves actually transmit pain. So look at that nerve on the left. That's an average, your average nerve that goes around your body. Some of them are motor nerves. That's about 40%. Now this is, what are these motor nerves? Yeah, this is for movement. This is how the body moves you. It's moving the muscles and it's creating movement, okay? So problems there will cause some weakness or some muscle spasms or some tightness. 40% of your nerves relate to those things we saw before. Remember? All the function of the body, all the organs. This is the autonomic nervous system. So that's 40% of the nerves. But if you look at the bottom there, the pain, posture, the hot and cold, these are the sensory nerves. This is only 10% of your nerves, the sensory nerves, and within those are your pain nerves. So think about it. You can have pressure on nerves and it can be affecting your motor nerves. So you might have some weakness. It can be affecting your autonomic nerves. So you can be having problems with perhaps your breathing or maybe your heart or blood pressure might be going up. But before you actually feel pain. Now, this is really, really quite important that you understand this. The most common symptom of a subluxation, which is a spinal lesion, is actually no symptom at all. Plenty people have all sorts of problems. In fact, sometimes people come into our clinics without pain, but they have an awareness that they're stiffening, something's not right. So we do an X-ray and we see some terrible degeneration of the spine, but they're not yet feeling pain. So pain is actually a very poor indication of what's going wrong. In fact, if you think about some of the most terrible conditions that we can get, and I'm talking heart disease or diabetes or cancer, pain is one of the last things that you feel, okay? Think even something as small as tooth decay. By the time you've got tooth decay, by the time you've got pain, you've probably got a real problem, you know, something that needs filling, or you've got, so think about when you are starting to get pain, is this an early sign of a problem or is it a late sign? And actually, it's actually a late sign. By the time you're suffering from pain, there's something wrong, okay? So we want to get onto these things as early as we can. And actually, we want to continually be checking people as they go through their lives, especially if they've got these sedentary lifestyles. So we don't want people to start to suffer from pain, because then it's probably already too late. So ask yourself, what is your pain telling you? Right? Now, this is really, really important. We ask these very simple questions with all our clients because it gives us an indication of how it started, what was the cause, what's provoking it. So think here. How did you start to suffer from pain? How did it start? What caused it? Is it worsening? What makes it better? What makes it worse? These are really interesting things, because if we understand the answers to these questions, then it gives us some very, very important information that we can apply. What is your perception of what is wrong? Some people say, oh, it's the muscle. Well, that's good. I understand that you feel the pain in the muscle, but I'm thinking, is it the cause or is it the consequence? I want us to think a little bit more deeply, because as we go deep, we find the answer. Maybe, is it a joint pain? You know, is it central to the spine or is it out wide? Or perhaps is it nerve pain? Do you get that burning or tingling pain that's maybe radiating down your arm or your leg? These are really, really interesting questions, because what we want to do is understand the cause. Because today, I want you to start thinking what I call the big idea. Because if we can understand the cause, then we can literally work our way towards the right cure. Okay? So I want us to think about, like, in this modern life, let's think about it. What could be the cause? 3 big problems in this life. 1, forward head posture. This is something we see everywhere. Almost all my patients that come in, their lifestyle has brought their heads forward. And now this is creating an imbalance, it's creating tightness, and it will ultimately cause loss of function and pain. So that's number 1, it's posture, this forward head posture. Number 2, we've touched on already, spinal deconditioning. Lack of movement. This sedentary lifestyle, remember, we are designed to move. As with the human body in almost every single sense, whether we're talking about your muscle or your bone or your joints or your brain even, if you don't use it, you lose it. And if you're not moving your spine, then it's going to decondition, right? So again, think about it. If you are suffering from spinal deconditioning due to lack of movement, then quite simply, we've got to get movement back into our lives. And then the third one I would say is lack of understanding, perhaps. I've said knowledge, but so basically, if we don't know certain things, then we can trip up. So poor techniques, you know, what are those things? Well, poor techniques, doing almost anything. Things that you do repeatedly. If you drive your car a lot, or maybe you're a taxi driver, or maybe you spend a lot of time on your computer. This will be the biggest thing in Singapore, I think. If you have poor technique, i.e. you're sitting in that poor posture position all day, every day, this is a poor technique, it's going to cause problems. Maybe it's a poor technique lifting, or maybe housework. If you're leaning forward, cooking, or doing your housework all the time, and you have poor technique, maybe this is going to bring problems to the surface. Okay? So again, so these are three of the biggest problems. So I'm thinking in terms of three. So let's think in terms of threes. My next three things is how can we start to address these things? And what I'd like to do is ask Jerry to put up the third poll, because what I'd like to know is, what are you doing to lessen or relieve your back pain? What are you doing? Are you taking painkillers? Are you doing nothing? Just heading for bed, you know, for some rest? Maybe some self-help techniques. Maybe you stretch, or you apply a heat pack or ice pack, or maybe some kind of lotion or cream. Or maybe you are seeking some kind of professional help. You're going to the doctor, the physio, chiropractor, or whatever. I'm interested to know what you're doing. All right, so that's interesting. So by far the most people they go through they have self-help. You know, what they do is they employ techniques of self-help. So I would imagine maybe that's a bit of rest or stretching or heat packs or whatever. I do know lots of people come to us. They say they've been doing all sorts of things to try and look after themselves. Interesting. A quarter of the people are seeking professional help. Okay, so that is a good thing. That's probably something that I would encourage. If you're just starting to get a bit of pain, then of course self-help. Then towards the end of this presentation, maybe I can give you a few ideas there. 10% do nothing, head for bed. Well, I understand that. The end of the day, if you're feeling a bit achy, then you know maybe a bit of rest can help. 10%, that's 1 in 10 are taking painkillers. Obviously, that's not a good thing. So let's think. I like to think in terms of this traffic light approach. Think about it. You can either stop doing certain things. I'm sure that will help in certain instances. Maybe there's some things you need to slow down, and maybe some things you could start doing, right? So let's think about that. What could you stop doing that's definitely causing problems? Well, how about if you are eating really inflammatory food? That would be a bad thing. If you're not drinking water, that would be a good thing to stop doing. So you could stop not having water, and you could stop taking water, because we need water constantly during the day, because it fuels our system, but it also lubricates our joints and our discs. What about slowing down? Things that you could probably slow down. Yeah, I'm sure there's something. Think about it. What we want to do is keeping things simple is I'm going to talk about the three-legged stool. Now, what I want to do is I'm going to keep it really simple here. These are three things that I want you to do. Number one, I'm a chiropractor. So if you really want to get out of pain, I want you to start thinking about having your adjustments in rhythm. Now, what do I mean by that? Most people who have pain have stiffness. So we've got to get over the stiffness. We've got to get the movement back in the spine. So a period of adjustments in rhythm, so that maybe once a week or twice a week for a period, will allow us to take your function from there up to there, right? Now, once we do that, we can teach you how to then maintain it up there. For many people, this will be life-changing. A few little adjustments at the beginning will help you definitely get out of pain. This we do know. But adjustments in rhythm over a period of time will help you actually make lasting changes that you can then sustain. And then if you employ some kind of wellness routine of adjustments, maybe once a month or twice a month, with stretching and exercise, and then we can actually get to a higher level of health, which is what we want. Think about habits. This is the second leg of the stool. Why a three-legged stool? Well, because if you only do two of these, you've only got two legs, you're still out of balance, okay? These are my three legs of the stool to get you back into balance. So the second one, breaking bad habits. So I've been talking today about what bad habits you might have. So we want to break them. So that might be sitting badly. It might be not exercising. It might be the foods you have. It might be too much screen time, all sorts of things. But become aware. Simple changes now can make a big difference later. And then, of course, the third leg of my stool is exercise. We need to strengthen. Obviously, the sedentary lifestyle is having a toll on us. Our muscles are becoming weak, and we're out of balance. And obviously, if we have weak muscles, it's not supporting our structure, and things start to go wrong. So, what kind of exercises? Well, quite simple things, really. We need to be moving our body. We need to have some kind of exercise whereby our heart is pumping. We want some exercise where we're getting out of balance. What do? I do plenty of dog walking. I go to the gym. I was there this morning. I did probably 20 to 30 minutes of cardio, and I did some strengthening exercises. That's what I do 2 or 3 times a week. It doesn't have to be crazy, but it's got to be part of our lifestyle. Okay. Now, I've gone through quite a bit of stuff now. What I wanted to do today was try and make it as proactive as possible. So I'm going to come to your questions in a moment. But first of all, I'm going to address questions that have been sent in to me. Okay. And I'll just go through these quickly. So first question that was sent in was, I know I need to improve my posture, but it feels so unnatural and is so tiring. Now, this is something that people say to me very, very often. And let's think about it. I know that it is tiring during the day, and gravity takes us into this bad posture. And if your posture looks something like this, let me tell you, this pretty much guarantees pain eventually. We know what good posture looks like. Obviously, that lady on the right looks very comfortable in her own body. She's got great posture. Well, the reason being is that the gravity line that goes straight down through her structure is nice and straight. This is what we want. But most people tell me that when they pull themselves into that posture, it's quite tiring. And that is simply because you've grown into a new shape. So it takes time. All I can say to you is that please keep correcting yourself. Good posture is very simple, 3 things. Lift your sternum, so that's your breastbone. Lift that up. Pull your head back on your shoulders. Open your shoulders. Engage your abs. Very, very simple. Now, that probably feels a little bit of a strain. If you do that with me. But if you keep correcting yourself, I promise you, gradually it will become more and more normal. Okay. Talking about posture, we've got to address the things that we do all day, every day. So if you're working at your desk, you've got to get you've simply got to get it right. So your head needs to be on your shoulders, arms ideally need to be supported to take the weight of your shoulders. Your screen needs to be nice and high. Your wrists should be resting comfortably on the desk. Ideally, you'll have a nice support for your low back, and you should feel comfortable. Your arms should be 90 degrees, and your legs, again, not less than 90 degrees, so it's not causing any restriction. Okay, a very, very simple thing to do. But so many people forget to get this basic thing right. Then, of course, you've got to get up and move around a couple of times every hour. Okay, so this posture is very, very important. So the second question that was sent in.
Actually, can we jump in, Tim? We've got a few questions to come in that I can ask you.
Yeah, you can. Yeah, I can come back to the other ones after.
Okay.
Absolutely.
So Sharon has said that she sprained her lower back 2 months ago, and it's recovered almost 75%, but she sprained it again last weekend and is stiff.
Okay. So muscles suffer from sprain, joints from strain. So if you have a muscle sprain, what's actually happened is that you've actually torn the muscles. It might be only a tiny tear. Some of the muscle fibers have been torn, and that created pain, it created inflammation. And if you're not getting the range of motion back, you actually get some scar tissue formation. So it recovered almost 75%, you said, but then it's very easy to sprain it again. Okay, so it hasn't fully recovered. So really, what I've got to stress is that you've got to allow it to recover fully. And when you've sprained a muscle, it nearly always takes a while. What you don't want is a weakness. So listen to your body. Know how far you can push it. Obviously, you've pushed it too far. Okay, listen to your body. It's probably not that serious, but if you keep straining it, then you're going to get a buildup of scar tissue. Okay, then you're asking for trouble later on. It will heal, but you want the joints to heal with full range of motion. So gentle movement. Range of motion, so stretching. You can, if it's the muscle, you can try a little bit of heat, maybe. If it's on the muscle, I wouldn't be putting heat on joints that are inflamed. I would use a cold pack, but on muscle that's tight and achy, you could try a little bit of heat. That might soften it up a bit. But really, you've got to listen to your body and let it heal. Okay.
Okay, thank you. Then this is a good one. Back pain due to a heavy school bag. Any recommendation on what to use to relieve the pain?
Yeah, well, I totally understand this. Some of these school bags are ridiculous. They're full of books and laptops and God knows what. If it goes on your back, then your head goes forward to counterbalance it. It's causing tremendous strain. It's putting pressure on your low back. So really, we've got to try and minimize the weight. We've got to try and get it high up on our shoulders. So think about it. If it's low down, it's probably doing more damage. So try and get it high up, reduce the weight. Even better, perhaps do what I did with my kids when they were young. I got them bags on wheels. Yes, they did look like air stewardesses or pilots arriving at the airport, but you know what? It worked for them. And that's obviously a very good thing. Getting a bag that you can tow is a good thing. You can alternate it from shoulder to shoulder. Definitely don't just hang it on one shoulder all the time. Change from shoulder to shoulder. But it is a problem. I do acknowledge that. You've got to work with it. So try reduce the weight, and then think about your technique. Okay.
Okay, thank you. Okay, next one's about sciatic nerve pain. Is sciatic nerve pain considered part of back pain? Mine is caused by regular sport, like football. Sometimes when it gets really bad, I will get a painkiller injection from my family doctor. Is it curable by chiropractic?
Okay, so sciatic pain. Actually, I'm going to go, let's just go back to, hopefully you can see that one. So the sciatic nerve is the nerve that runs all the way down your leg. It comes from the back. So normally, and I'm talking about 99% of cases, it's actually it's a low back problem, and it's coming from one of the probably either the bottom joint or the second joint. Okay, these are the most common joints where we have problems, and if it's going down the legs, something is pinching the nerve or irritating the nerve. So what could that be? Well, it could be a bone out of place, it could be muscle tightness, it could be inflammation, it could be bone spurs, it could be the disc starting to bulge. Now, whatever the cause, we do know that there will be a cause. And so again, I understand you take painkillers and you have to rest, then it seems to recover. But my strong warning is be very, very careful. If it's a disc problem, then you really do not want to blow the disc, because that could be a life-changing situation. You do not want to, I strongly recommend you perhaps take advantage of the offer that we're going to give you at the end of this, so you can come in at a discounted rate. But yes, sport can exacerbate it, of course. Injections will help, but are they addressing the cause? I think not. There is nearly always a cause that we can find by means of examination, X-ray, sometimes MRI, but usually we just do a standing X-ray so we can see the true alignment. And it's normally, if somebody has got a nerve problem, and sciatic is a nerve problem, then it is becoming more serious. Okay, it is becoming more serious. So you really do want to get onto this. We can nearly always see the cause when we do a standing X-ray, and yes, we do X-ray everybody that comes in that has nerve problems. Okay, because it's becoming a problem that's more serious. The other instances where we will X-ray people is if we are aware that there is a really bad alignment. So maybe we're aware that somebody's got a twisted spine or something like that. We're definitely going to do an X-ray so we can help them. We're more focused in our care. And then if we are aware that there is a degenerative situation, so if we are pretty sure that there is arthritis or degeneration building in the spine, we're going to do an X-ray for sure. Okay, so that would be my strong recommendation, is get onto it, see a professional, because just having injections is not fixing it. And one day an injection won't fix it. Okay, so moving on.
Okay, so thanks for all your questions, everyone. Keep them coming in. We've got quite a few for Tim to answer.
Good ones.
This lady is saying, I have degenerative disc at L4 and S1. What exercise is good for me? Okay, so a degenerating disc happens for many reasons. So one, the joints are out of alignment. That's going to cause deterioration. Poor movement in the disc, that is also definitely going to cause degeneration. Your discs do not, I repeat, not have a direct blood supply, which means we absolutely have to get movement back into the joint. Movement causes that imbibation. That's that word that we used before. So movement creates a pumping action that brings in the blood supply and the nutrition and the oxygen into the disc. So this is what we fundamentally got to do. If you've got a disc problem, we've got to restore the alignment and the function. And this is what our adjustments do. And then, of course, exercises to stabilize the whole thing afterwards. So what exercises can you do? Well, think about movements. I mean, one that I want everybody to do very simply when you're sitting at your desk, I'm just going to move away a little bit, is I want you every now and again just to arch your back. I'm arching my back, and then relax. Arch and relax. Arch and relax. So I'm putting some curve in my back and relaxing, putting some curve in my back and relaxing. And what I'm doing is I'm opening and closing the discs. And I'm literally sucking in blood and nutrition into those discs. That's a very, very good thing to do.
Okay, please get up from your desk every 20 minutes or so. Move around a little bit, go and get some water. These are the main things. I'm going to, right at the end of this slide, I'm going to go, just in case I don't have enough time, I'm just going to go along. One of the great things you can do for your disc, if you can see my screen now, is to get an exercise ball. Just have a little bounce at the end of the day, just bouncing. It puts great movement in the discs, in the spine, and it also it stimulates all the spinal reflexes, all the muscles that protect the spine. So that's a great thing that you can do. Okay, so let's move on.
Okay, so adding to the earlier question about spraining the back, someone's saying, is it true that once you've strained your back, it can always reoccur easily again?
Well, the answer is yes and no. If you don't allow it to heal properly, then you could end up with some recurring problems. Once you have a lesion in the spine, we've got to get movement, we've got to get function back so that it heals functionally. If you heal with a stiff back, you've rested too much, and you haven't been moving while you've been healing, then you can end up with a stiff back. And once muscles are stiff, these are very easy to sprain. Okay. We have lots and lots of sports people that come in. Obviously, sports people are pulling their muscles all the time. But once we've restored people back to balance, muscles can release. And once you've had the right rehabilitation, then muscles can be functional. They can be elastic, but they can be very functional so that they work properly. This is what we want. We want good balance, and we want good functional muscles. But if you don't allow that to happen, then yes, you have a weakness, and this type of thing can reoccur. Okay?
Okay, this lady has had scoliosis, which was discovered at age 11. She's now 42 years old and has aches and pains at the lower back. How can she improve or reverse the condition, and what forms of exercises are ideal?
Okay, so obviously we see a lot of scoliosis in our clinics. Obviously, scoliosis is, for those that don't know, is when you have got a twist in the spine. This is definitely going to create areas of pressure, tension. You're going to end up with muscle imbalances and things like that. It will nearly always end up with tightness and pain. So yes, we need to be spending our life working to try and neutralize this, trying to work with it. It's not something, once you get to 42, it's probably not something that's going to go away, unless it's very mild. But if you've got quite a decent curve there, that's causing some problems, then it's probably not going to go away, but we can probably reduce it slightly. What we've got to do is work out which muscles are tight and stretch them, which muscles are weak. There is something in the spine called reciprocal inhibition. So when one muscle gets tight, another one releases. So when you have a scoliosis, you've got parts of your spine are very tight and parts of it are very weak. So this will always cause increasing dysfunction and pain. So these are things that we need to work with. Yes, we do have various ways of working with scoliosis using blocks. You lie over blocks and things. We use something called scoli rolls, which you lie on, and they help take the curves out of the spine. They can help enormously. That's something that we can only advise with in the clinic. Some great things you can do are exercises out of gravity. So swimming is something that I think almost everybody with scoliosis should do. There's things like cat and dog, where you go up and down with your spine, putting more curve and less curve into your spine. Working with a ball, lying over the exercise ball can really help stretch the spine over. Swimming is my favorite one for scoliosis, but the thing is, every scoliosis is different, and so we really have we do have protocols that help. So I think it's one of these cases where if you haven't seen a professional, then I really do advise it. We have protocols that do work, that will help you enormously. Okay.
Okay, and it's the lady with the sprained lower back. So she's saying that when she was on the bed, she felt a sharp pain shoot all the way down to her last 2 toes. Been feeling the aching and pain when I'm walking, sitting and laying down these last few days. Is it the muscle or nerve issue, and what exercises can we do to strengthen the area?
Okay, well, obviously there's going to be some muscle involvement. You've got pain in the low back and what have you. But now when you tell me that that you've had some pain that shoots down to the toes, then again, that gets a little bit more potentially serious. So you want to be thinking a little bit more more deeply about that. If you look again at that slide that I put up, you can see that the nerves that come from the low back, they go all the way down to the leg, and then they go to the toes. So as chiropractors, we know which nerves they are. We know which levels that we need to look at. So this is something that we really should be looking at for you, so we can give you the very best advice. Things that you can do yourself, yes, you can be doing some stretching. I've got a few things right here that you can be doing. Oh yeah, this is a good one. So at the end of the day, if you're tight, we want you to lengthen and open your spine. So if you kneel on the floor and really open things up, that's going to really open up your low back. That is a very, very, very good thing that you can do. Another thing you can do are some gentle low back stretches, lying on your back, pulling your knees all the way to your chest. That's going to open things up. While you're lying in bed, you can do this. If you're stiff in the morning, you just lie on the bed, just pull your knees in, perhaps let your feet go down, and then just, you see that picture on the right, you can just flop your knees from side to side. That's going to get some good movement into those joints. So these are some very simple things that you can do that will help. But again, once there is a nerve involvement, then you should be looking for some professional advice. Okay.
Okay, do you want to go on to some of those questions that people sent in, and I'll let you know if any more come in live?
Yeah, I've just got so that one that I mentioned before. Why do I sometimes go to bed with no pain but wake up very stiff in the morning? Well, you know what? Every now and again, I get a bad back because I spend all my life leaning over a client. So I have to look after it. And, I don't have a bad back, but I can definitely strain it from time to time. And I can go to bed at night, actually not too bad, but I can wake up in the morning pretty stiff. So why is that? Well, basically, once you've got a little bit of a problem in the back, you need to be moving the back as much as possible to bring in the blood, bring in the nutrition to help healing. Okay? Well, this movement lubricates the joints. Obviously, we're lying in bed, there's no movement. So I'm afraid the way it is, if you've got a little bit of deterioration of the spine, it might be early or mid stages of arthritis starting, and I'm afraid all arthritic joints stiffen up in bed. Okay, it's just the way it is. Now, of course, we can think a little bit more cleverly about it, and we can think about how we sleep. If we sleep with a spine that is not neutral, and perhaps we have a mattress that's too soft, we have a sagging spine, that's going to strain the ligaments, and you're going to wake up very, very stiff. So think about how you sleep. Your spine wants to be as neutral as possible. Okay, I hope that makes sense. Another one that was sent in: why is it usually the simplest little thing that starts my back hurting? Yep, well, I can definitely relate to that. Somebody told me that they put their back out just doing their shoelaces the other day, and I can really, really relate to it. So unfortunately, we've created this life where we spend most of our time leaning forward. I mentioned housework. It could be leaning forward cooking. I have a number of chefs coming in at the moment, lifting heavy pans. That is classically something that triggers it. We've got to be on high alert when we are leaning forward doing something. Look at this guy. This guy is leaning over, picking up a package. He is asking for trouble. All that stress is going through his spine. He needs to think a little bit more smartly. Perhaps he could think about lifting more like the guy, not on the left, but the guy on the right. You've got to look after your spine. So engage your abs, have a nice shape to your spine, bring the box to you, and then let your legs do the heavy lifting. Okay, we've got to be smart about things. Another question I had was, what are the best exercises when my back is aching? Well, literally, I mentioned that before. Get some movement in there, improve your posture, have a little bounce on the ball perhaps, get away from your desk, move around. These are, roll your shoulders, get some movement in there. I've got one where I use quite a lot when I'm at my desk if I'm a bit achy. I call it YWLT. You will love this. Okay, you will love this. Very simple things. I'm pulling my shoulders back, I'm pulling my head back, and I'm getting some movement in those shoulders. Okay, YWLT. You could try it yourself. It's a very, very simple thing. One thing that I do quite often, and I recommend it highly for most people that are spending their life in this forward posture. Get yourself a roller. There you see me on the left doing my rolling out my upper back. Too many people are getting stiff upper back, so a simple solution there is the roller. Works very, very, very well. Okay. Well, that's about most of the questions that I'm going to go through. Did I have any more? Oh yeah, here, this was a good one. I hear this quite often. My doctor wants me to go and see a specialist, but I'm worried that he will recommend surgery. So I really am dedicated to helping people avoid surgery. It is a statistical fact that if you go to an orthopedist, you're something like 60% more likely to end up in surgery. If you come to a chiropractor, we fix more than 96% of people, so they don't need surgery. So, the stats are in our favor. Here's one thing I would really like you to do. Start asking clever questions. Here's a rather gruesome looking surgery. They're putting some, this is a spinal fixation. So they're fusing the spine. This is probably a series of disc problems. We don't want to go that way. If your doctor is suggesting surgery, these are some of the things you want to be asking. What are the risks involved? What are the costs involved? What are my expected outcomes? Can I talk to 5 patients that have had a similar surgery? Can I listen to their story? Because I'm fearful. I want to know what to expect. What does the research say? Here's a good question. What is the likely outcome 5 years after the surgery? Okay, I don't want to know 1 year after. I want to know 5 years after. Because if you get a stiff spine because of surgery, then what's happening is that the joints above and below that surgery are now doing much, much more worse. And they are highly more likely to break down in the future. So what other options do I have? And another good question. And then you could ask things like, is this treating my symptoms? Or is it actually correcting the problem? Okay. If what are we doing in the surgery? Are we just taking out the bulging disc? But if there was a cause, a twisted spine or something, are we addressing that? So, ask the question, what is the cause of the problem? And can they actually tell you? Okay, I think these are really, really, really important things that we can learn. I've had a few more. Let's go through a few quick fire questions that people had. Back supports, are they good or bad? Well, they can be good and bad. So you should only wear a back support if you're doing something like lifting, or perhaps you're cooking or something. You should not be wearing them all the time. I want your back to support be your muscles. Okay, so don't get into that situation where you're wearing back supports all the time. Only when you really need it. Cell cracking, good or bad? Okay, it's bad. Don't be looking for the crack. I want you to be moving your joints, stretching your joints. Now, when you're stretching, if you feel a crack, then that's okay. It's just tension coming out. But don't become a cracker, all right? Don't be looking for the crack because you are making joints hypermobile. I hope that makes sense. One question I'm asked all the time, should I try yoga or Pilates? Actually, I don't care. They both strengthen, they both help you with balance. They both help improve range of motion. What I would say is find an instructor that inspires you, because it only works if you keep going back. So find a trainer or instructor that inspires you, so then it can become part of your life. I think that's a good answer. And then when should I not exercise? That's a really good question. I want you to always be aware of your body. Just check in with your body all the time. If you know you've got a problem, think, should I be exercising right now? If it's a little bit achy, then maybe tone the exercise down. There are certainly some times when your body will say, don't exercise. If you've got some real pain, then do not exercise. If you find that you're in terrible pain after exercise, there's clearly something wrong. So really, you're going to have to, again, think smartly, communicate with your body, listen to it, give it what it wants. It might be some simple stretching. It might be the fact that you don't want to be doing some vigorous exercise on a particular day. Maybe just some gentle exercises would be better for you. Okay, so those are pretty much all the questions that I've had sent in. I think that's pretty much. I'm just looking anymore. Yeah, I think that's about it. So I'd like to thank you all for listening in. Some really good questions there. I've enjoyed it. Again, we have recorded this, so if anybody wants to pass this information on to anyone, it will be on our social media. I'd like to, again, thank you very much. I'm just going to pop up my final slide. If you know anybody that needs us, anybody that's suffering from pain, or anybody that's got some disc problems, or you're worried about any postures of any family members, then do take advantage of this. It's up there. You can use that QR code, or you can just engage us. Tell us that you saw my presentation. Normally it's $170 to come into our clinics. For anybody that is referred as a result of this presentation, it's only $45. Okay, so that's for a full chiropractic visit, full examination and treatment and recommendations. Okay, so I'll just leave that up there for a couple more moments so you can take that down. And again, I'd like to thank you very much. Enjoyed it immensely. I will say good night to you tonight, right now. And thank you very much. Good night.
Would you